Hello, my name is Kishore and I'm 32 years old and I live in Canada. I've been living in Canada for past 10, 11 years. I'm a Canadian citizen and I've been operated or diagnosed with multi-level surgery for sleep apnea, severe obstructive sleep apnea. Oxygen levels falling below 70%, which is a severe condition for sleep apnea, suffering from snoring, restlessness, tiredness, and sleeping while driving. So I've been consulting my doctors and over there in Canada, and they suggested to go for surgery as I have enlarged tonsils and deviated septum. But the question is, why, if you're a Canadian, why you come to India and do a surgery? The thing is, in Canada, everything is regulated by the government and there is a long wait times. They gave me a 1 year, almost 15 months wait list to get my surgery done. So I thought it's not a wise decision to wait for another 1.5 years to get it done over there. So while I had my trip in India, so I thought I would get this done in India. And while researching hospitals and good doctors for ENT specialist. First I went to Apollo and I've seen other doctors, but I'm more convinced with Dr. Sampoorna Ghosh, how she explained the situation and the steps and what the benefits I could have after this. So she studied the sleep study and performed a DICE study and showed me how severe is my sleep apnea and how I'm not able to breathe. So I went for fully multi-level surgery for tonsillectomy, turbinoplasty, septoplasty, and palatoplasty. It means she removed my tonsils and she opened my septum, corrected the deviated septum, and also trimmed the turbinoids to clear the more air passage. And also the palate is trimmed and opened and with stitches. And initially I thought this is something like a big surgery or something, but Dr. Sampoorna Ghosh helped me understand that how simple it is, and I had my surgery performed just 2 weeks ago, and not even 2 weeks, it's almost just 12 days. So I'm really fine. I just had the surgery for 4 hours for my nose, septum correction and turbinoplasty in the nose, and also palatoplasty and tonsillectomy performed at the same time for 4 continuous hours under general anesthesia. And I just stayed one night in the hospitals. It's a typical time, and some people may stay 2 nights. I'm good with 1 day. So, and the doctor tested me, reviewed everything, and after that I was discharged. And after 1 week, I was on complete IV antibiotics and analgesics, and also I'm on liquid diet. And after 10 days, I fully recovered, and I'm doing good, very good now. I can speak well. Initially, you'll have the first week, it'll be a little bit of pain, but after that, with antibiotics and analgesics, everything will be good. The more important things are to keep your nose clean with IV wash and gargling with iodine after every meal or liquid diet you take. And it's pretty much a very good experience working with Dr. Sampoorna Ghosh. So, and even with the hospitals, I almost went to see four to five different hospitals, and above all those, I find Sunshine is very flexible with timings and very clean hospital. That's what I look for, clean hospital and flexible. The doctor is also flexible with any questions or anything. You can even call her anytime and you can WhatsApp her anytime. And the hospital staff is also friendly, and the main important thing is it's clean and it's not crowded for an RA patient like me. And it's a good hospital. I would highly recommend for people getting this surgery in this hospital.
Sunshine, it's our sunshine.